Thank you, Joanne, for that very nice introduction. And let me say, just thank you for the invitation to speak, and thank you to yourself and to Greg and all the team. I've been an avid reader of Wired for many, many years, and so it's a great thrill for me to be able to speak at this event, and particularly with so many distinguished colleagues. So I'm going to talk a little bit about AI in healthcare, and I think it's fair to say that everyone attending this meeting will know that there's a lot of excitement and a lot of hype around the potential of AI to transform healthcare, and I do believe in that potential, even leaving aside the hype. And what I believe also is that ophthalmology, my specialty, is at the forefront of this transformation and can be an exemplar for other medical specialties in how AI can be transformative. Now, just to give you a little bit about my background, so I'm a consultant ophthalmologist at Moorfields Eye Hospital in London, where I specialize in the treatment of retinal diseases like macular degeneration and diabetic eye disease. I'm also an associate professor at UCL at the Institute of Ophthalmology, and I'm funded by UK Research and Innovation, and I feel very fortunate to have that support. These are also my disclosures, which I think will be very relevant to some of the things I'm going to talk to you about. And then lastly, I'm going to try and squeeze in three things that I feel really excited about. And the first of these is going to be around the Moorfields, Google, and Deepmind collaboration. So why do we need new technologies and innovation and artificial intelligence in healthcare? Well, I love to show this picture, particularly to my medical colleagues in other specialties who sometimes think that ophthalmology is a niche specialty or kind of like a cushy number in some respects. But in fact, in 2017, ophthalmology overtook orthopedics as the #1 busiest specialty in the National Health Service in the UK in terms of clinic appointments. In fact, nearly 10% of clinic appointments in the NHS are for eyes, and that constitutes nearly 10 million appointments per year. And that number is rising fast. So the fact is, we are in some senses drowning in the number of patients that we need to see. Now, the problem with that is that some people are essentially going blind because they cannot be seen and treated quickly enough. And so there was a particularly tragic case at the end of 2019 that got a lot of media attention at the start of the year. Pre-pandemic, it seems like an awful long time ago now, but essentially this was a woman in the south of England who was in her 30s, who was pregnant, and she had glaucoma. And in fact, she had advanced glaucoma, which is a condition where you have high pressure that damages the nerve at the back of the eyes. And she needed urgent surgery to save her sight. And for whatever reason, there was delays in getting that surgery and she went blind. Now, the fact is, I could not think of a more tragic scenario to illustrate the logistical challenges that we face in the system and why I think that new technologies, and in particular AI, have at least some role in addressing this problem. Now, with that being the case, in 2016, Moorfields Eye Hospital, where I'm a consultant, signed a formal research collaboration agreement with the artificial intelligence company Deepmind. Now, I guess everybody attending a Wired event is going to know a little bit about Deepmind, but they may not know that the background to this was actually about a year earlier, in July 2015, when I was reading a profile about Deepmind in Wired magazine. And there was just so many things in that article that resonated with me. And in particular, the fact that 2 of the 3 co-founders are from London, 2 of the 3 co-founders are alumni of UCL. And I just felt these are the people, these will be good people to contact. And so I found Mustafa Suleiman's profile on LinkedIn, and I actually took out a 1-month premium subscription just so that I could send him a message without being connected. And I said, I'm a consultant at Moorfields. We have people going blind because they cannot be seen and treated quickly enough. We should work together to use AI to transform ophthalmology. And by the way, Moorfields is just 2 stops away from you on the tube in London. So that initiated the collaboration, and then in August and September of 2018, it was very exciting to publish the first results of the collaboration in the journal Nature Medicine. And you can see it was a real big group effort with people from UCL, Moorfields, and from Deepmind. And it was also a great honor that it was featured on the cover of Nature Medicine. And this being AI, you can't escape the hype around it, and it got global media attention. And it's very exciting to see your research get that sort of media attention. And you can imagine how exciting that was for my friends and for my family. And my mother in Ireland was telling all the relatives about how great her son was or is, and all of these things. But at the same time, it's a little bit awkward because the fact is we haven't saved the sight of millions of people yet. And we're just sort of halfway through a journey to getting to that point. And the algorithm that we've developed isn't yet in real world clinical use. And I'm going to tell you a little bit more background around that. So here's a short video of the algorithm in action. And so it works on something called OCT scans, which are optical coherence tomography scans. These are high resolution images of the retina. And this is a patient with poorly controlled diabetes. It's a guy in his 40s. And essentially, the algorithm is delineating the waterlogged, the edema within the macula of this patient. And then at the top, in the top row, it's making a classification decision. So it's saying this is macular edema and this requires semi-urgent referral to see a retina specialist, someone like me. Now, where we're at is we're trying to implement this now. And so something that I call going from code to the clinic. And so to do that, it turns out that publishing a paper as a proof of concept is the easy part, and actually going towards implementation is much more difficult. And so we're looking at new pathways of care. Moorfields is building a new hospital in the King's Cross area, which will begin being built next year. We're already trying to think about how we can have the flexibility in the design of that hospital to actually take advantage of these technologies. The other thing to highlight is that increasingly these retinal scans, these OCT scans, are being used in the community. And this is an opportunity for us to bring world-class expertise through AI into the community for much better outcomes with our patients. And then lastly, we're working towards use of things like smartphone apps to monitor vision within the home. And we're working with Roche on implementation of these. And that's particularly in the context, important in the context of a pandemic. So let me tell you about some other things that we're doing just in the second half of this talk. We've learned a heck of a lot from the collaboration between Moorfields and Google, and more recently with Deepmind, and more recently with Google. And so one of the things that we've really become aware of is at Moorfields how much imaging we have. And for those people not aware who are listening, Moorfields is the oldest eye hospital in the world, and it's the largest eye hospital in either Europe or North America. So in fact, we see more than twice the number of patients of the largest center in the US. In fact, we now generate, we estimate, about 1.2 million ophthalmic images per year. And so this collaboration has allowed us to build the technical infrastructure to be able to aggregate and curate our data and actually move it to the cloud. And so increasingly, I think use of cloud infrastructure will be essential for healthcare institutions. Now, not only are we doing that, towards the end of 2019, we received funding from Health Data Research UK, or HDR UK, through the Industrial Strategy Challenge Fund in the UK to form something which is called the Insight Health Data Research Hub for Eye Health. And the idea for Insight is to share what we've learned at Moorfields with our partners in Birmingham, and then with other NHS trusts around the UK, so we can create a national ophthalmic bioresource that will really allow the NHS and the UK to really reap the benefits of artificial intelligence. The other thing that I'd like to highlight is that we've learned a lot about how to approach the ethics and the information governance and the patient and public involvement for clinical AI studies. And this has allowed us to do something called the Alzheimer's Eye Study. And Alzheimer's Eye is a study where we use the eye as a window to the rest of the body. And this is an old idea, but in the last couple of years with deep learning, we can now look at a retinal photograph, which we can see here, and we can say, this is a woman. She's 58 years old. She's not a smoker. She's not a diabetic. Her BMI is around 25 and her blood pressure is around 150/85. Now, to me, that's staggering. Now, if you're skeptical, you may say, well, there are easier ways to tell that it's a man or a woman or the age of a patient than applying AI to a retinal photograph. But why we're excited is that we think that if we can get the appropriate data sets, then we can find much more in the back of the eye about the rest of the body's health using deep learning. And so with that being the case, we've instituted something that we call the ALZ Eye Study, or Alzheimer's Eye Study. And we've taken more than 3 million OCT scans at Moorfields from more than 300,000 patients, and we've linked them with NHS Digital Hospital episode statistics data. And so this is where the expertise that we accrued in ethics and governance of clinical AI allowed us to make this linkage. And so we now know every person at Moorfields who has had a retinal scan, who's gone on to develop a heart attack, or who's gone on to develop Alzheimer's or other causes of dementia. And in fact, the numbers are staggering. So we have one or potentially two orders of magnitude larger numbers of patients than massive cohort studies in the UK, such as UK Biobank, or even on a world stage. Now, if you're interested in learning more about this, there was an article about it in The Economist in December 2019, and this was really focusing on the attention to detail that we've done in terms of the data linkage and the governance and the data protection aspects of making this linkage. And it's something we're very proud of, and something that we're very keen to share the learnings of. So the last thing I'd like to talk about in my last minute or so is the emerging AI ecosystem that I see developing. So much of our initial work at Moorfields in AI has been with Google and with industry collaborators. More recently, we've developed a lot of links with computer scientists and academia. But what I'm really excited about is empowering healthcare professionals to begin exploring AI systems. And this was inspired by an article in the New York Times in 2017 about building AI that can build AI. And this is the idea that there's multiple, that the major tech companies and a number of startups have automated deep learning platforms increasingly available that allow people without coding experience, typically with drag and drop interfaces, to develop deep learning systems. And so when we saw that, we immediately said, let's do that in healthcare. So we got some publicly available medical imaging data sets, and we got people from my research group with no coding experience. And the thrilling thing for us is that, within a short period of time, we were able to get results that were comparable to state of the art. Now, there's lots of caveats to that, don't get me wrong, but this is something that we're tremendously excited about. So I think that this could be a bicycle for the mind. And this is an advertisement from 1980 about Apple Computer. Bicycle for the mind was a term that Steve Jobs coined. And so, I think we forget that in the 1970s, the idea of a personal computer was very strange to the mainstream computer industry. And we had famous quotes such as this from Ken Olsen from Digital. But what pioneers like Steve Jobs and Steve Wozniak realized is that if you give people personal computers, even if they're crude, they will come up with hundreds or thousands or more applications for this technology. And I think that automated deep learning has that potential in healthcare. So I say to clinicians in the audience, if not you, then who? Sign up for one of these platforms, get some public data sets, and start to explore. Now, there's some caveats. You shouldn't use your own institution's healthcare data without going through approvals. And nobody is saying that these can be used for direct patient care anytime soon, but nevertheless, many applications in clinical research. So just to finish up in my last couple of slides, I think that we have the potential to reinvent the eye examination for the 21st century. If you're interested in learning a little bit more about that, I was privileged to write a short essay about this with Eric Topol in The Lancet at the end of 2019. And then lastly, where are the next steps? Well, I think we need to move towards implementation. I think AI-assisted scientific discovery is going to be vital. But I think we're going to be moving towards a second phase of clinical AI, where it's more about democratization and industrialization of the technology. And I think healthcare professionals need to be at the center of that. And then lastly, it's a bit hard to see, but if anybody wants to get in touch, please feel to drop me an email or find me on Twitter. Thank you very much.